Broadcast is now starting. All attendees are in listen-only mode.
Good morning, gentlemen and ladies, and anyone else. Can some of you please just indicate if you can hear, if the sound is coming through okay, please? Okay, from 50 or so online, it seems at least 20 of you can hear, so we'll regard that as very encouraging. Right, healthcare, America, United States. Let's have a little bit of a high-level look at this and see if we can use that to help the way we're managing our own money, which is what all of us with Standard Bank online share trading are trying to do. A little bit of admin, which we don't need to read out loud, but you've seen it now. Okay, so the big US health firms, what do they do? And I think this is the first interesting question because they do substantially different things to what the local, the JSE health type businesses do. So I think that's the first thing to understand, is the big companies there tend to be dominated by pharmaceuticals. Johnson & Johnson, the senior, the elder statesman there, also has a huge devices, that means sort of surgical devices, implants and things like that, and also a huge consumer arm. So, but still that's, there's a lot of pharma in there, including some veterinary pharma. Interesting also that number 3 there, United Health, which has been a strong outperformer of late. It's more or less doubled in the last 3 years, and it's shot in there. And that's a little bit like our Discovery in the sense that it offers benefits and the services kind of more in the financial management and administration kind of approach rather than being a traditional health product or service provider. And then Anthem also lower down, and then, Stryker. So I've just looked at the top 15 businesses here. We'll get a sense of their scale just now. So that's just a little bit of an introduction, which is first things first, that the enormous America open for business approach has led to these giant firms, and pharmaceuticals is really the anchor for the big dogs in that sector. Now they're just a snapshot looking at the sector, and this is where the critics of the sector go hop up and down and say there's something wrong, because there does seem to be a huge anomaly here. So what the graph shows, the x-axis, the horizontal axis, shows spend per capita on healthcare, and you can see the USA data point sitting at nearly $10,000 is kind of double what most of the rest of the world spends. So they spend more money per person in that country on healthcare, and yet the vertical axis is life expectancy. So they don't seem to get their people in aggregate to live any longer. Now there's obviously some strange mixes here, because a lot of, if you just have a look at some of those Senate hearings, Nancy Pelosi is not exactly a teenager. So they've got a lot of substantially well-preserved, long-living people, but they've also got a huge, one might call it almost a sort of an underclass of people who are not being reached by the healthcare system. So the sort of polarity between the very well-off and the very not well-off in America is quite striking, and that would obviously drag down the life expectancy. And interestingly, whether those rich people are spending it on Botox procedures or muscle implants to try and stay younger for longer or what, I'm not quite sure. But it does stick out as maybe a national system that's definitely worthy of some criticism. And it's big, because that many 320 million people spending $9,000 or $10,000 per year per breathing human, from infants to elderly. Anyway, so there it is, not without criticism. Interesting also how much regulation there is. I don't know if any of you have been to the US lately, but yeah, they do tend to have quite a lot of rules and hoops to jump through and so on. And we will touch on that again, but I just think it's quite important to understand that regulation can be frustrating for a visitor, it can be frustrating for a startup, but it can be fantastic for the companies that are already embedded in the system and have already got their licenses and their permits and their permissions and their lobbyists in Washington and everything else. So regulation, a really interesting to apply your mind to whether you're pro or anti-regulation. If certain of your holdings are within the regulations, then it becomes a barrier to entry. It makes it harder for the free market to compete with your investment. So maybe you should like regulation. On the other hand, if you're buccaneering, freebooting startups who are wanting to try and enter a market, then you're probably going to be critical of regulation. So it's quite an interesting thing just to think about. Another big point, which I just called here D, the so-called Obamacare story. So the Affordable Care Act, it's got a whole lot of short names, but the story here is basically to try and open this up and try and, rather than leaving the elite to be the only ones who are properly covered, then can't they open it up and, again, through force regulation, tax incentives and clawbacks and everything else, can't they try and get more people to be properly included? And that might drag the per capita number down, but the arguments of the people in favor of it would be to say if healthcare can then properly reach more and more people, then the nation as a whole would be healthier. So that's a little bit what that's about, and obviously a huge political story there for the likes of the either pro or anti-Donald Trump people. If you look into it, you're going to find a whole bunch of data about the cost breakdown on the national level, and all these sources obviously differ, partly depending on who's carrying out the study. But there are some general messages that come through, which I think we can look at and think about as to whether they tell us anything as South African investors. So just in terms of that sort of the drive towards simplification and universality of healthcare, the critics would say, as per that top diagram, that the current system is just way too complex and there's too many flows and clawbacks and reimbursements and deductibles and incentives and tax breaks and so on and so forth. And the argument would be, surely, if the White House was as pure as the driven snow, which I'm sure it is, then if everything just got channeled on a single basis straight through government and it went to funding and everybody had public health insurance, then everybody would be better off. And this is not that different, interestingly, to the arguments we have in South Africa about the national health insurance, or in Britain about the national health system, and so on and so forth. There are strong advocates for it. Generally, the advocates for it are often advocates of government dominance in many other ways too, and there are people who can't stand it, who just think it's completely wrong. And I suppose the truth is, to me, is that the real world ends up having a bit of both, where you have the government interfering with the private sector interfering with public health care, and here and there being opportunistic and running rings around. So it's a question of who should be given more of the ability to apply carrots and sticks to get people to do what you want. And yeah, it's an ongoing debate in America between the Republicans and the Democrats. A couple of comments also on the sector. Now, pharmaceuticals it's an industry we don't really have here. Yes, we have Aspen and Adcock, I know that. But the development of drugs is not really something we do here because we don't have the scale. It's very, very financially intensive. The maths would reveal, this is probably an industry stat, so should be taken with a little bit of salt, $2.5 billion odd to get a drug through the market, with all the trials and tests and admin and bureaucracy and so on. Interesting also how, if you did not have patent protection, they seem in America to pronounce what I call patents. So if you don't have patent protection, you wouldn't spend that sort of money because you would never ever get your money back. So this is part of the sort of intellectual property regime in America, which allows this sort of thing. Huge regulation, huge lobbying, and then the Food and Drug Administration, the guys who must end up authorizing or recording authorized drugs and so on. They bring out it used to be physically a book that was orange. The so-called Orange Book is now a website. You can go to it if you're interested. And you'll see all the different forms and versions and everything else of the FDA-approved drugs. There are 10 different versions of Advil. There's one with ibuprofen and so on and so forth. So you can go and look at all those things. And obviously the Orange Book is one of those regulatory hoops you've got to jump through, or one of those barriers to entry if you already have. Funding-wise, the mix of public and private, huge spend. And whichever way you look at it, you end up concluding that the admin and particularly the legal costs are enormous. I see Mr. Hart chipping in saying it's so expensive to have surgery over there. Well, one of the reasons is because if it doesn't go right, you're going to sue the guy. So the doctor's not stupid. So he says, well, if you might sue me, I better buy some insurance and then charge you for the insurance that I've bought. So, one can end up in a sort of nasty, vicious circle there where the costs go up and up and up. And the more legal, insurance and administrative costs you add on to the whole pie, somebody's got to end up paying for it. And you know what? It's normally the patient or the consumer. Other just interesting points is sort of so-called Western medicine, if I can use that term, is it actually the way to go? What about alternative medicines? What about ways and means of saying to people, listen, rather than taking pills morning, noon and night, rather live slightly differently, get a better diet, get a better exercise regime, maybe do some yoga and Pilates and walking and things like that. And these don't need to be gym bunny type of exercise. These can be much more natural lifestyle approaches. The baby boomers are starting to convert now into aged pensioners. So that normally refers to people born after World War II. That really is the generation that's ridden this huge wave of American prosperity. What happens when that plays out and these curious new quirky youngsters start making their choices and those play through into the economy? And are there enough hospitals and enough doctors and things like that? So all these questions emerge. Now, the interesting thing that you're starting to see now in the States is the so-called exchange growth. Now, what this is all about is really where you have some health insurance. Maybe your parents got you onto a package, or maybe your employer does, or something like that. But now what the free marketeers of the United States are doing is they're saying, yes, but you might not have exactly the right cover, or you might have moved town, or you might have moved state, or whatever. So what they're doing now is trying to, if you like, get out the way of this growth in healthcare exchanges. So there's a bunch more activity there. And as you can see, the early growth was in the public exchanges, and the more recent growth has been in private exchanges. So 40-something million people involved in signing up for these exchanges and exploring their options and having a look and saying, well, I might have cover with, in our language, with Sizwe Medical Fund, but there's a deal going and they're recruiting at PPS. So I'm going to actually convert my heart cover through to the PPS special offer, and I'm going to take some Discovery Core Classic for my chronics and so on. So there's this weird sort of secondary market now developing in cover, in benefits and services. And one of the beneficiaries of that, interestingly, has been that number 3 on the list that I mentioned earlier, United Healthcare, whose share price in the last 3 years has doubled against the Rolls-Royce Johnson & Johnson, which has been, tracking along quite nicely as a big blue chip at 14% a year, done 40% in 3 years. United Healthcare, the leading health insurance service provider over there, has doubled. Okay, so just quite an interesting thing. So some disruption and some turbulence happening there, and well worth just being aware of that when you're considering your position, maybe either as a patient, or as sending your kids across to go and have the surgical procedures over there because you're too scared to go to the Morningside Clinic or Grooteskier. And also as an investor, look out for something like this. A couple more points here, and it's just quite interesting. The American information universe is weird. It's in some ways completely lacking in transparency, and in other ways there's a whole bunch of these sort of poster or infographic type of information sets which try to make certain points. So if we look at those two on the left, how much money on different types of care. So there are your outpatients. Isn't that a beautiful way of saying outpatients? Your ambulatories, people who walk in. Inpatients, people inside hospitals. So those are about neck and neck at about a third of the pie. And then prescription drugs, 288 billion, nursing, dental, and emergency. So quite interesting just to get a sense of that spread. The biggest condition in terms of medication at the moment is diabetes, and the growth there over the last, 20 odd years, about 6%. So curious when you think about things like, is that running guy, the professor in Cape Town? I can never remember his name, but this whole sort of eating differently and avoiding carbs and so on. A lot of that stuff is to do with people having various exposures to the sort of diabetes type of conditions, their response to sugars and carbs and pasta and bread and so on. And if you can create an industry like that, which is then leading people to go and start seeking medication for that, I wonder if diabetes is actually, if it's occurring more now than it was, or if it's simply attracting more attention and more medication than it was 20 or 30 years ago. It's really interesting to think about that from a whole bunch of perspectives. But there you get a sense of what the sort of top 10 treatment areas are. And then the middle sector, also quite interesting. 8 out of 10 Americans are on a chronic, one of those never-ending recurring sources of annuity expenditure for the patient, and of income for the health industry. So quite interesting. And half of these have more than one. So you might have chronics for your diabetes and for your depression, or whatever. Also quite interesting how American people are not necessarily going to the doctor more than in other places. Okay, so they're only going to the doctor every 3 months, if you look at that. Okay, 4 times a year, as against every 2 months, more than 2 months in 34 other high income countries. But a huge difference. Look at the bottom there. You're twice as likely to be MRI'd. Now that's weird. So you get to see the doctor. The doctor's been around the block. He's probably got his own life and his own children and his own sort of social position to observe humanity. He's well read, hopefully did quite nicely, whether he studied in Cuba or at Johns Hopkins. And yet the first thing he does relative to certain other countries is he sticks you into a diagnostic technological device. And that's really good for the people who provide those diagnostic technological devices. And is it playing out well? Well, maybe it is for the guys above the curve in terms of American patient wellness. But is it reaching as far as it should into the whole American population? Doesn't seem to be, and doesn't seem to be working. And then also a lot of criticism of waste, just of the absolute outright waste. Unnecessary services, 200 billion. Excess administrative costs, 200 billion. Inefficient delivery, etc., etc. And obviously a bunch of fraud and so on. So a lot of criticism, of how people get on with what they're doing, B, how much waste there is, particularly the admin, and I suppose legal would probably, for some people, be considered going into that. And then unnecessary services, an enormous amount. So that's, if the total pie is maybe 2 or 3 trillion, what's that, maybe 5, 10, 15% of that is, giving people unnecessary MRIs, unnecessary surgical procedures, unnecessary prescriptions and treatments. And that's quite scary because, who gains out of that? Well, the healthcare sector does. So if you're an investor, maybe you'd like that. This is a bit like people ordering too many drinks at the pool at Sun City. It might be bad for them, but if you're a Sun City shareholder, that might be a good thing. So, lots of stuff to think about here, in terms of deciding whether or not you're interested in participating in the US healthcare sector. Okay, a couple of ratios here. And what I've tried to do here is I've taken that top 15, I've added company number 27 for reasons which will soon be obvious. I've just just plugged in some of these numbers just to get a sense of scale and relative valuation. So the top, what is that, 5 odd companies are the ones which we can't really get access to here. So these are the big IP pharmaceuticals companies and the integrated ones and the ones with a whole bunch of medical devices, because we don't really have big listed companies doing that here, do we? Okay, so, and those are enormous, and there's a flavor for their PE, their dividend yield, and the enormous size of their profits. 15 odd billion net profit for Johnson & Johnson. That's supposedly annual net income. Okay, then if we come down a rung and get more into the companies which are focusing on pharmaceuticals, there's a whole bunch of those from Pfizer through to Eli Lilly. And then here this starts getting interesting for South African, for JSE-minded people, because, we've got Aspen and we've got Adcock. Okay, so just have a look at the scale there. So the smallest, Bristol Myers Squibb, $76 billion market cap, Aspen, $3 billion. All right, was quite a lot more until not long ago. And Adcock, not quite a billion. And then just look at the size of the net profits, look at the multiples. So yeah, Aspen doesn't look expensive anymore, which it once did. But you've got a bunch of huge US pharmaceuticals companies, also in maybe low double-digit type PEs. So, look at Adcock at a 16, 2%, 2.25% dividend yield. Is there any reason for you to feel comfortable about owning Adcock as effectively a local pharma business when you've got access to a universe like this of big dogs? Quite interesting. Discovery I've dropped in there as a little bit of an offset to these only 2 in the top 15, United and Anthem. Not totally identical companies, different footprints. Discovery showing a lot of interesting initiative going into life insurance and banking now and stuff like that. So these United and Anthem probably more focused, more tightly, aggressively focused. But you can also get a little bit of a sense here, maybe for why when Discovery got a gleam in its eye and decided to go and slaughter the American market 15, 20 years ago, why it actually battled, because there are some huge, big, competent, aggressive, and expert companies here. They trade interestingly at relatively similar levels now, but they are just so much more dominant. So, if you had to arrive and say, "Hi, my name's Adrian, I've come to sell you guys some, medical benefits and services, administrative services," which is ultimately what they do, these guys are going to say, "Yep, okay, take a number, go and sit at the back." And we've got companies here which are 10 and 50, 40 times the size. So quite interesting just to get a flavor for that. And then for a lot of us as South Africans who think, but our healthcare is dominated by the Ruperts with Mediclinic and by Jackie Shell's Netcare and the old Afrox, which is now Life Healthcare. Yeah, they have hospital companies over there. The biggest one I could find, HCA, tracked in way outside my top 15, number 26 or 7 by market cap in the sector. And you get a sense here also just how big it is, 45 billion and 13 multiple, quite a low dividend there, but quite strongly profitable also, 4 billion in profits. So different scale, different shape, and get access, if you're interested, into buying more into pharma, into research, and into devices. There's not as much hospital investing available at the top of the sector by scale. Okay, and then if you're, which I think you should definitely be reflective of, if you're considering investing over there, you can go on a single stock basis. We've had a quick look at those, but what you can also do is go for some of the ETFs, and there are a couple of broad categories here. So if you go for the broad healthcare ones, then you tend to get these sort of weightings where you've got a good chunk of the traditional J&J and then all those big drug companies, but you also got United in there, and more of the mix as per the sector. Or if you want to, you can go for more of the biotech, the sort of developmental ones, the sporting bets on the next research breakthrough that might be important. Or you can go more for a devices health ETF. So, that would be along the lines of this IHI type of product, or the biotech ones. There are quite a few options there. And yes, the exchange traded fund industry there is quite competitive, so you do tend to get attractive looking expense ratios once you're over there. But you've got to watch out for that, because depending on your platform, how you're reaching in from South Africa, you might find you're actually facing a effective annual cost, including the whole link of service providers, from, let's say, from Durban across to America, where that thin little yield, if you're getting only a 1/6 of 1% yield on a biotech ETF, that yield might not be enough for you to stay aboard. So you might find then that your actual holdings are having to shrink across time, because there's not enough cash yield to pay for your entire structure costs of how you've taken that exposure. So just be a little bit aware of what you're doing. So to wrap it up, I see we're nearly at 12:30, and then hopefully we're going to get some questions. I see a few trickling in here. Mr. Hart looks quite keen on this. This is fantastic. So very, very different sector to what we have here in a whole bunch of ways. Ample scale and liquidity, big stocks if you like the simplicity of just buying into Eli Lilly or J&J or whatever. Sector regulation does look messy and in flux, but that's quite interesting, because it does tend to favor the incumbents, and the incumbents in America are always spending quite a lot of money on lobbying and on staying abreast of new developments. So I'm not altogether sure that would make me negative on the big stocks there. And quite interesting to see just how popular, if you look at those low yields, the American investing community does seem to like those high payoff bets on biotech. They don't seem able to resist it. Imagine if they can find an amazing new treatment for, whatever it is, skin cancer or heart disease or something else. And also quite interesting just how much this whole new flux in this exchange universe of insurance and benefit trading, how that's led to United Healthcare racing up the tables. So, a couple of interesting things to think about here. One, to me, maybe the most important one, is with offsets available like this from our own universe, why is it that so many of our South African corporations seem to feel this obsession to have to go and ply their trade outside of South Africa? They get good here, they get competent, they get skilled, they become cash generative. And then rather than giving that cash back to the owners, which is you and me, they always seem inclined to go charging off. And, this is a conceptual question. Look at Woolworths Pick and Pay in Australia. Look at consolidated infrastructure going up into Africa. Look at Discovery itself going into America 20 years ago, maybe before it was fully ready to. And, are we as owners of the South African, of the JSE companies, are we actually expressing enough common sense in terms of helping the directors and the boards be better guided as to where they should go and what they should do? So that's quite an interesting question for us all, I think. Okay, concentrate now on your questions, I hope. And I must just obviously give you that general disclaimer from SBG Securities, your host this morning. Okay, see what we've got on the question board here. And otherwise, thanks very much for participating, and I hope it's been worth your while. Okay. So, yeah, David, thanks. Yeah, quite right. $6,000 to whip out an appendix. What that would probably have a total integrated cost here of about 10,000 Rand, I would guess, depending on your hospital. David also pointing out, which I think is a very helpful observation, how the lack of transparency around costs. And yeah, this is a really interesting one, is once they've got you signed up and signed in, then it does get really difficult to know exactly what the costs are for what type of treatment. If you have a titanium rather than a plastic implant, what's the difference, etc., etc. And classic illustration that I think of an industry where they've taken control of the cash flows, and then you become both the patient and the payer. Also just the observation that diabetes growth is driven by lifestyle, by obesity. Yeah, but that's exactly the point I'm making, is to say if we take people and manage them towards a certain kind of lifestyle where there's a certain cost to them, benefit to us, how do we feel about that? Advanced diagnostics, quite interesting there also. And again, from an insurance perspective, you've got to be seen to have done what a reasonable doctor might have done in your position. You can't simply say, well, I saw a chap like that who looked a bit like you one day when I was fishing on the Orange River near Uppington, therefore I'm going to take a stab and tell you what I think is wrong with you. You're going to end up being treated better by your insurance and by the legal fraternity. You're going to come snapping at your heels if you got if you can demonstrate that you've done everything that is reasonable. And if the reasonable thing to do is to charge a whole lot of money to get the latest equipment or to send someone by referral or to the latest test and so on, then that's what you're going to do, because you can't afford to jeopardize your practice or your holiday home or your kids' fine education, whether you've done a Felicity Huffman and got them into an expensive school or whether they're just around the corner. So yeah, a lot of strange aspects there relating to the American litigious way of life. And then an interesting question here from Keen. You've had trouble finding a US focused exchange like Securities Online. What is like SPG Securities Online? Yeah, Keen, there's a whole bunch of them. I think if you go in and have a look, if you're interested, online share trading in America is a substantially more developed thing than here. What you do have to be a little bit careful of is different rules between different states. So you've got to understand the regulations and the flows and the rules and obligations. So you've got to think about where you want to invest, and you've got to think about particularly where you want to get the money back to or from. So if you're pursuing US investing because you've got dependence in the state of Minnesota or something like that, that's going to give you a different set of answers to what it is if you're looking to invest from here in through Manhattan in order to get the money back here one day. So there's a whole bunch of different questions there which I think are probably not really US healthcare specific. And yeah, maybe that's a separate exercise which maybe warrants separate discussion. Okay, are there any other questions? Are there any other slides you guys would like to go back to and think about again? Otherwise, let's move on and let's think about the really the fascinating scale and different shape of the US healthcare universe. And particularly, let's always try and avoid falling into the trap of thinking that the investable universe starts and ends in our beloved JSE. It is important that we understand the JSE well, because it's our closest one, but it's definitely not the only thing we need to be thinking about when we're trying to safeguard our financial future. Thanks very much, everybody. Thanks for sitting in on the webinar. I hope it's been with you well. Cheers, everybody.